Good morning, one and all. Today I am going to discuss about how to represent the answers in the pharmacology theory examination. It may be sessional exam, it may be practical exam, it may be theory exam, or it may be university exam, or it may be your assignment exam, whatever it may be. Okay. Here thing is all the students will have difficulty to represent the answers because some students will be knowing the subject very well but they may not be represent, then they will get the less marks. Here what I am going to discuss is how to write the answers in the your exam. Either it may be essay questions or short notes question. As for at present in cbmb curriculum you have one two essay questions, 10 short notes and 20 mcqs. Yeah. Now, if they ask essay question, how to write? Normally, essay questions will be having automatically subheadings like they will give you one case scenario. Below that, they will be given diagnosis like that. For just a simple way, I am tell you, when they ask essay question, read properly and you just give some introduction about that and diagnosis. Your diagnosis will make the very important thing, because if you diagnosis correctly only you can write the correct. Okay, you can write the answer correct. First you write the diagnosis, then below that they will be written classification of drugs, uses of drugs, pharmacological action, like that they will be asking the questions below that. Then you can write according to that. But each and everything essay question, what they ask only you write the answer. Don't write what unnecessary things. Write according to that, because if you start writing unnecessary things, then you will lose the time. Time is the very important. Time management is the very important in the exam. Okay, this is related to the essay question. Then come to the important thing is the short question. Normally short questions will be having three types. One is that they may ask single drug, or they may ask the class of drugs, or they ask the management of poisoning, or they will ask the antibiotic. Only these are the classes of things. One is the single drug or class of drug, or antimicrobial agent, or poisoning. For example, if they ask one question as a single drug, I give an example as a atropine. Okay, question is short notes is atropine. How you are going to write? Okay, here you have the 10 headings. Please remember these 10 headings, and whatever short notes they ask drug, you should write under these following headings. Because if you remember under these following headings, you can easily write it. Okay, now what it is? First they ask the question like atropine. First you have to write which class it is. Okay, first you should write which class it belongs. In the class also will have, it will come one class under subclass. Then you have to write the subclass, then followed by class. For example, atropine. Atropine is a natural product of anticholinergic drug. Like that, each and every drug will have the things you have to write. Next, chemistry. Chemistry is not important for all the things, only some require the important, like heparin. Then if you say sulfonamides, like that, very important thing. If you write it or not write it also not a problem, but if you write it will be good, because all will write common things only. If you want to make a difference from your friends and other people, you have to write add something else. Okay, like that, chemistry. Then source also not required for all the drugs, only important things for like natural products, semi synthetic, derived from the animals, derived from the ordinary technology, like that, any specific thing is there, you write the source. Then come to the very important part of the short notes is mechanism of action. Always what I have seen or observed in this thing is all the students, most of the students, means not all, most of the students will write mechanism of action is a in the writing, like 10 lines, 20 lines. That will, it's not look good. And it is very difficult to find what are the points in that. Instead of that, you make diagram, you make the flow charts. Some students ask, sir, this drug don't have the flow chart, this drug don't have the diagram, what to do? Then you make yourself, because in the mechanism of action maximum 4 or 3 points will be there important, that you keep it and write as a flow chart, or you write the diagram. Diagrammatic representation and the flow chart will reduce the time spending on the writing. Okay, that time you can use for any tough question comes, or if you want to think, then you can write it. Okay, then come to the pharmacological actions. Pharmacological actions, what you have to do is don't write haphazard. Write from human body starting from the CNS to toe. Then you start from CNS, then eyes, nose, next mouth, respiratory system, cardiovascular system. Like that, each system you write. Here, what you have to write pharmacological actions is system, receptor, what is the action, what is the effect. Okay, I repeat, system, receptor, action, and effect. Like that, you make as a table. Instead of writing everything as a paragraph, it will won't give much impression, and it is very difficult to correction also. That's why for a mechanism of action you make the diagram and flow chart. For pharmacological actions you make the flow tables. Then pharmacokinetics, you can have the important things as a pharmacokinetics, not general things. If you see the drugs, some drugs will have the high molecular weight, then some drugs will absorb only in the acidic pH, basic pH, like that. Okay, then you write only important thing. In the pharmacokinetics, four things: absorption, distribution, metabolism, excretion. In that, what is important only you write. Okay, as second year MBBS students, much they won't expect pharmacokinetics from you, but anything is very very important, like redistribution, highly plasma protein, excreted in the fecal matter, excreted in the breast milk, like that things are very important, only you write it. Then come to the pharmacological uses. Always I suggest to the students pharmacological as uses, right? Disease and how drug will be useful in that condition. Okay, disease name, normally they will write just disease name and leave, but it everyone do like that. But if you want to, your answer sheet should be look different, and you should have to score more marks on it. Write disease and how it will be useful, one line or two lines max. Then adverse drug reaction. In the adverse drug reactions, write first important adverse drug reaction. Remember three or four. General adverse drug reaction, you write or not write, it won't make much difference. But for each drug, we have some important adverse drug reaction that you note down and remember. Drug interaction, you write two. Drug interactions, drug, and what is the question drug, you which drug have interaction, three words. One, what is the your question, then which drug interaction, what is the effect, like that. Contraindication, you write minimum two. But in this major portion where you can score marks is mechanism of action, pharmacological uses, adverse effect. These are the three important portions where we will look for thing. Okay, there you should concentrate and you should write the important. Okay, now question, this is related to the single systemic drug. For example, it comes as a antimicrobial agent. Headings will be the same. Okay, headings will be the same, but only extra will come is you have already seen in the class chemistry, source, mechanism of action. Then for antimicrobial agents, you have to extra is antimicrobial resistance, how it will get the resistance, right? Specific resistant mechanism first, then followed by general. Okay, always you remember one thing is write important things first, then write common things next. Okay, then antimicrobial resistant, then how they will get the resistant. Each antimicrobial will have specific and general, that you can mention. Then come to the antimicrobial spectrum. This is a very very important part. Antimicrobial spectrum, if you write organisms correctly, uses you will write correctly, because they are the link. Antimicrobial spectrum and uses have the link. Then pharmacokinetics, as I already told you, very important things only you mentioned. Then pharmacological actions, for antimicrobial spectrum, you write the disease causative organism. Disease causative organism. That will give good marks and good impression. Adverse drug reactions also very important. Adverse drug reactions you write it. Rest other common you can write it. And then drug interactions, two drug interactions, then contraindication two if you have. But here some students will ask, some of the drugs or some of the antimicrobial don't have any drug interaction, don't have contraindication, then no need to mention. This is a common thing I am telling. Okay, then if not there, just leave it. And always in your exam they will ask prototype drugs. Prototype means very important drugs. Okay, now another part of the thing is, they will some will think, if question come as a poisoning, management of poisoning, like atropine, management of atropine poisoning, treatment for organophosphate. Then how you have to represent is the concept is same. First, what is, which class is poisoning agent, then what is its chemistry, then mechanism of action, how it will cause, where it will bind, how it will produce it, that you have to explain. Here also mechanism of action you can write in the diagrammatic way or you can write in the flow chart. Then symptoms. Symptoms you make system, receptor, what symptom. Okay, I repeat, system, receptor, then what symptom. Then come to the treatment part. In the treatment part, what you have to do is general treatment. What you will do in the general, okay. Then come to the specific antidote. In the specific antidote, you have to write the mechanism of action. How this antidote will useful in this poisoning condition. Okay, how this drug will be useful in that poisoning condition, then dose, then duration, route of administration, then when to stop. These are the headings should be there under specific antidote, because most of the students just write the antidote just like that. Like for example, if you say organophosphate, they will write atropine, but they won't write the dose, duration. It's a general thing is when they ask, when you see the management or treatment in the word means you have to mention the dose, duration, route of administration, when to stop. But some drugs is not required when to stop, some only required that when you are reading you will know. Okay, this is the how you can represent the questions in your exam. If you follow these things you will get surely good marks. Okay, from now onwards I will posting how to do the MCQ, how to write the short notes, how to represent everything. Please subscribe my channel and like it. Okay, every day I will give the things like one prototype drug, how to write, and after that I will give some MCQs, because you in your curriculum 20 marks, in your exam 20 marks is there for MCQ. Most of the students will be struggling for doing the MCQ. I will tell you some tricks how to easy do. Okay, what I suggest to the students, whenever you are preparing the questions for your exam, please follow these headings and follow right in the thing, because if you remember in a sequence way you can represent is that. Then if make one notes after the your class over, then they will respective teacher will tell you important thing. But if you miss anything, some heading they have missed, then you can ask it and make one separate notes. Okay, I repeat, mechanism of action make as a flow chart and flow charts or diagram, or you can set in the net also, you can make your own. And I think I will tell you one thing, pharmacology is not a quantity base, it is a quality base. How quality your answer, your marks will be that. Okay, how much quality you write, that much marks you will get. And always you remember important things, don't give importance to the unimportant things. Okay, please subscribe my channel for further updates. Thank you so much.